video on. Does anybody need to take a comfort break?
Can you hear me?
Yep.
I'm happy to have you here. I'm so excited to meet you here.
Hello.
I'm Dr. Mohammadreza Sani, Pediatric Pulmonology Fellow from the University of Tehran, and it is a CF short course. About 68 nurses attending here and are eager to hear your presentation.
Thank you. Thank you. Right, I'm just going to try and share my screen with you. Okay, can you see that okay?
Yes.
Brilliant. Right, let's go. Whoa. Okay, thank you. So my name's Karen Henney. I'm a clinical nurse specialist here at the Royal Brompton, and my talk today is concerning the when children start nursery, when children start school, and then transition to secondary school. These are the types of conversations that we'll be going into school and having with the teachers and the staff and parents.
معرفی کردن خانم کرن هینی پرستار بیمارستان و موضوع صحبتشون این هست که موقعی که کودکان میخوان در مدرسه وظیفه پیدا بکنن از یک مدرسه به مدرسه دیگه برن میتونن مطالب CF با چه مسائلی روبرو میشن و قرار راجع به اهمیت مدرسه و حضور کودکان مبتلا به CF در مدرسه سخن بگیم. Yes, Karen, we are with you. Thank you.
Thank you. And the reason that we do this is because, for the most part, cystic fibrosis is what we would call an invisible disease. Children in the UK usually present very well, and if we were to line up a classroom full of children, it would be difficult here to be able to pick out the child that has a potentially life-limiting condition. But we're mindful that being an invisible condition, there are still factors that we need to highlight and raise with staff in order to be able to keep children safe and well within their school environment.
علت این که ملاقات در مدرسه و حضور در مدرسه رو پیشنهاد می‌کنن اینه که CF یک بیماری نامرئی هستش که کودکانی که در انگلستان مبتلا به CF هستن معمولاً با تابلوی خوب و با حال عمومی خوب مراجعه می‌کنن و بدحال نیستن و اینه که موقعی که ما می‌خوایم به حضور این کودکان رو در مدرسه در نظر داشته باشیم باید عوامل مختلف مثل عوامل محیطی رو هم مد نظر قرار بدیم تا باعث بشه که حضور ایمن در مدرسه داشته باشیم و کودکان هم بتونن از سلامتی خودشون و از داشتن یه سلامتی شاد لذت ببرن.
So what we want the staff to be aware of is that cystic fibrosis is a genetically inherited, potentially life-limiting condition. We tell them the statistics around the numbers of children that are born each week with CF. And then we also highlight that for here in the UK, 1 in 25 of us in the population is actually a carrier of the CF gene.
بیماری ژنتیکی هستش که به طریق ژنتیکی به ارث میرسه و به طور بالقوه یک بیماری محدود کننده زندگی هستش که بر ترشحات بدن اثر میذاره. هر هفته حدود 5 بچه با CF مبتلا به CF متولد میشن که تقریبا 1 در هر 2500 موالید زنده هستش و 1 نفر از هر 25 نفر ناقل این بیماری است.
Thank you. So what we're actually highlighting, and the reason that we want the staff to be aware, is that we try to explain that if you're a carrier of the CF gene, there's often no family history, and that a carrier of the CF gene won't usually have any symptoms. Then again, we describe the fact that 1 in 4 children may be affected. There's a 2 in 4 chance of a child being a carrier. And the reason that we highlight this is because quite often there will be siblings in the same school, and staff may be wondering why a certain child is affected and not the sibling. And also the child might also ask that question.
CF مبتلا میشیم اغلب سابقه خانوادگی CF منفی هستش و ناقلین مبتلا معمولا بدون علامت هستند. شانس ابتلا در هر کودک 1/4 هستش، 1/4 شانس عدم ابتلا هستش و شانس ناقل بودن 2 در هر 4 بارداری هستش. این معمولا این سوالی است که از ما میپرسن که بچه چطوری مبتلا به CF شده که پاسخ در نحوه توارث ژنتیکی هستش. Yes, Karen.
Thank you. We just tell the staff around that since 2007 here in the UK that we've been testing for cystic fibrosis on the Guthrie Hill spot test, and that we just highlight that that means that CF can be diagnosed sooner and the appropriate treatment can be started. And it also gives them some context as to when the health team actually started getting involved with the family and when the child was diagnosed.
CF معمولا با برنامه قربالگری موضوعی هستش که دلومیتری از پاشنه پا هستش که به عنوان بخشی از برنامه قربالگری گاتری انجام میشه در تمام کودکان و مسئله اینجاست که هر چی CF رو زودتر تشخیص بدیم میتونیم درمان مناسب رو زودتر آغاز بکنیم و قاعدتاً خدمت به بیماران و کیفیت زندگی بیماران بهبود خواهد کرد. Yes, Karen.
We explain that cystic fibrosis is a chronic and progressive condition, and that despite lots and lots of research happening, unfortunately, there still is no cure. That it is on a spectrum, so it can be very mild to very severe, and that for the majority of children, they sit quite nice and comfortably in the middle. We do talk about the median age of survival being around the 40s, and the reason that we do that is because if staff then access our resources or start looking on the CF Trust website, they're going to see information about that. We also highlight that it is a multi-system disease, and I'll go on to talk a little bit about that in the next slide.
بیماری مزمن و پیش‌رونده است که علیرغم تحقیقات مستمر و بسیار زیادی که برای اون انجام شده همچنان درمان قطعی ندارد. باید یادآوری بکنیم که CF یک طیفی از علائم هست، از بسیار خفیف تا بسیار شدید. بقای متوسط بیماران CF در حدود 40 سال هستش، یعنی بین 40 تا 50 سال. و باید یادآوری بکنیم، خاطرنشان بکنیم که CF یک بیماری چند ارگانی هست و چندین ارگان رو درگیر می‌کنه.
So we explain that we expect the children and young people to be coming into class happy and healthy, and that we know that cystic fibrosis is a part of them, it's not all of them. So we don't expect them to be coming in poorly and coughing and unwell. What we expect is for a child to be coming in, we know that they might get coughs and colds the same as their peers, but actually their coughs and colds can last a bit longer, and also the parents will be contacting us to inform us that the child has got a heavy cold or a hacking cough so that we can start oral antibiotic treatment, and that this is different for their peers because we're reminding staff that it is an invisible condition and that actually what's going on in our lungs is quite different to what is going on in the lungs of a child with cystic fibrosis. And as part of the teaching, I won't do it now, but as part of the teaching, we do describe to them, you know, about the liquid lining our airways is much more clear, helps to keep us free from infection, and how it's much thicker and stickier in somebody with cystic fibrosis. So we will explain a little bit about what the underlying condition of CF is.
میگن که بچه‌های مبتلا به CF که میخوان در مدرسه وجود پیدا کنن باید بپذیریم که CF بخشی از اونهاست، نه همه اونها. و اینا وجود دیگری غیر از CF هم دارن. مسئله که هستش کودکان مبتلا به CF شکایت میکنن که وقتی ما در مدرسه حاضر میشیم چرا وجود علائم مشابهی که مثل بقیه بچه‌ها داریم برای ما درمان‌های خیلی شدیدتر مثل آنتی‌بیوتیک مثل درمان‌های پیچیده‌تر آغاز میشه، ولی بچه‌های همسن سال ما درمان‌هاشون متفاوت هست و علائمی که مبتلا به بیماری میشن در این درمان‌ها رو دریافت نمی‌کنن. پاسخ این هست که بیماری CF موقعیتی داره که ریه‌های افراد مبتلا به CF با ریه‌های افراد مبتلا به افراد عادی فرق می‌کنه. در این ریه‌ها ترشحات غلیظ و چسبندگی تولید میشه که مجموعه هوایی کوچک رو می‌بنده و باعث التهاب و عفونت میشه و به ریه‌ها آسیب می‌رسونه. دو تا روند خیلی اساسی اینفلامیشن و اینفکشن هستش. علائمی که معمولا کودکان مبتلا به CF رو درگیر میکنه و گاهی اوقات مانع از ورودشون در مدرسه میشه سرفه‌های آزاردهنده، ویزینگ احتمالی یا قسمت که مکرر، عفونت‌های مکرر یا دیگ‌های تخصصی هستش. بسیار بدید.
Thank you. We also highlight to teaching staff as well that it's easier in nursery age children than the older children. But if children are working on a small space and a child's got a hacking cough or green candles, that we try to get that child moved discreetly. But we just raise that concern with the staff so that they're aware.
یک اصلا اینه که این ممکن علائم بیماران مبتلا به CF خفیف باشه ولی با توجه به بیماری زمینه‌ای که دارن ما نگرانی زیادی داریم که بیماری علائم حتی خفیف ممکنه پیش‌خرابان و آغازگر بیماری جدی‌تر بشه.
So in the same way that the secretions are much thicker and stickier in the lungs, we explain that they're also thick and sticky in the gut too. And that most children, the majority of children, will be coming into school and they will be bringing their crayon with them. Now, usually, these would be kept in the school office, and the child would go to the office at lunchtime. So we want staff to be aware of the importance of how much crayon to have. So normally the parents would provide, they're very expert, they would provide a little note in their packed lunch, or they would be sent a menu, a copy of the menu, so that they can work out how much crayon their child has with that particular meal. And the child from a very young age gets used to going to the school office, collecting their crayon and having that just before their school meal. We also explain to them that if, say, for instance, they are going to have some milk at break time and for whatever reason the child doesn't get their crayon, say the fire alarm goes off and all of the children go outside, that actually crayon only has a 20 to 30 minute maximum time of working. So when they come back in, if it was over half an hour, they would need more crayon, and that's okay. They wouldn't be overdosing them, and that's also really important to emphasize.
یکی هستش میگه این که بیماران مبتلا به CF همونجور که ترشحات غلیظ و چسبنده در سیستم تنفسیشون دارن، همین ترشحات غلیظ و چسبنده در مجرای گوارششون هم خواهند داشت و بنابراین عملکرد پانکراس و عملکرد مجرای گوارشی ممکنه عملکرد مجرای گوارشی مختل هستش. مجرای این بیماران بسته هستش و نمیتونن آنزیم‌های گوارشی ترشح بکنن. این مسئله که ذکر کردم این بود که گاهی اوقات بچه‌هایی که در مدرسه بچه‌ها مبتلا به CF که در مدرسه حاضر میشن، والدین براشون غذاهاشون رو بسته‌بندی میکنن و کلمونی که میفرستن در یک تعداد مشخصی هستش و گاهی اوقات یک کپی از اون برنامه غذایی که بهشون در اختیارشون قرار داده شده با خودشون همراه میارن، ولی معمولا بچه‌ها چون برنامه زمانبندی دقیقی برای مصرف غذاشون ندارن، ممکنه این کلمون‌ها یا این چیزایی که برای مدرسه میفرستن تغییر نیازهای غذایی که برای مدرسه دارن باعث بشه که اینها به مقادیر مختلفی تغییر بکنه. اما میگن که این مسئله خیلی حاد و آزاردهنده نیست و میتونیم اینو با آموزشی که با خانواده رو انجام بدیم مورد نظر قرار بدیم. اگر به این مسائل دقت نکنیم کاهش وزن خواهیم داشت، وزن بچه شروع میکنه به کاهش پیدا کردن، مفهوم چرب و چسبنده پیدا خواهد کرد. نیازمند این هستیم که غذاهای پرکالری‌تر مصرف بشه و غذاهایی مصرف بشه که چربی بالاتری داشته باشه تا بتونه وزن رو حفظ کنه و همچنین نمک و املاح بیشتری باید این بیماران مصرف کنه.
Thank you. We also just mentioned to staff as well that it's really important that the children have access to their water bottles, and we explain the rationale behind that. We also explained to them that it's actually okay for our young people with cystic fibrosis to be having salt on their food, because in schools today, it wouldn't be considered appropriate for a child to have salt on their food. So we explain why. Historically, we would have been saying that children should have a high calorie, high fat diet to maintain weight. But since the introduction of modulated therapy, we have to sort of advise that actually children can have a diet that is much more in keeping with their peers.
که مسئله نیست که بچه‌ها مبتلا به CF دسترسی آزاد حتما بچه‌ها دسترسی مبتلا به CF باید دسترسی آزاد به آب داشته باشن تا از دیهیدریشن جلوگیری می‌کنیم که باعث غلیظ شدن چسبان ترشحاتشون میشه. دسترسی به نمک اشکالی نداره، قبلا اون تابویی که برای نمک در مدارس بود الان وجود نداره، اما با توجه به پیدایش درمان‌های جدیدتر مثل درمان‌های مدیریتی تعدیل کننده نیازمند این هستیم که در بعضی از این توصیه‌ها بازبینی بکنیم.
Thank you. And then I've just mentioned on this slide that for some of our children, we'll be having conversations with their teachers about the fact that they have developed CF-related diabetes. So I'm going out to a school this afternoon to change the healthcare plan and to explain to staff, as Katie mentioned earlier, what how we manage that in a school.
دیگه که باید صحبت بشه راجبش اینه که بعضی از این بچه‌ها مراجعه می‌کنن و میگن که علائم دیابت براشون تشخیص داده شده و این هم نیازمند این هست که صحبت‌های بیشتری با والدین و بیماران صورت بگیره تا این موضوع رو هم به طور مناسب تحت اقدامات تشخیصی قرار بدیم.
We just leave this with the staff, just in terms of sort of explaining what they particularly need their Creon with. So we have explained to them that they have Creon with any fat-containing drink, snack, or meal, and this slide just helps sort of explain that sort of a bit more clearly to help them. Some of our children in school will have a portacath. So the reason that I've included this slide is just so that if we do have a child who has a portacath in situ, we can show staff what it looks like under the skin and highlight the importance of if a child is knocked or falls over or complains that it hurts or it's red or it's swelling, that staff are aware then it's on the healthcare plan so that they can actually seek medical advice if anything happens with that.
بچه‌های مبتلا به CF پورتاکات یا کاتتر پورت دارن که در این پوست قفسه سینه‌شون تغذیه شده. اینها معمولا مشکل خاصی ایجاد نمی‌کنن، اما اگر تورم، حساسیت یا شکایت‌های پوستی براشون ایجاد بشه نیازمند این هستن که در جستجوی توصیه‌های پزشکی باشن.
We explain to staff that all of the treatment that children with cystic fibrosis do is aimed at slowing down and minimizing the effects of their disease. So what we usually do, we don't tell them individually what all of the different treatments and medications are, all of the oral, nebulized, possibly injected medications are, but we do highlight to them the extent so that they know that in the morning before a child comes into school, they've done a lot of treatment, they've had to get up earlier than their peers, and when they get home from school, they're having to repeat that treatment. So whereas as their peers are getting in from school and they want a bag of crisps and to watch TV, the young people with CF have got things that they have to do every day before they can even start to think about relaxing in that same way.
درمان‌های استنشاقی هستش، آنزیم‌هایی که کمک می‌کنه برای هضم مواد غذایی و ویتامین‌هایی که به علت اینکه عملکرد پانکراس قابل تلافی نیستن، ویتامین‌های A, D و K هستش. میگه که بیماران مبتلا به CF وقتی به مدرسه مراجعه می‌کنن بیان می‌کنن که در مصرف بعضی از این داروها مشکل دارن یا ممکنه وقتی در مدرسه وجود پیدا می‌کنه تداخلی در نقل مصرف این داروهاشون به وجود بیاد و وقتی به وجود بیاد که ما موظف هستیم در اون دوباره مسائل رو بازبینی کنیم.
Thank you. We advocate exercise. So within UK schools, a lot of the children are encouraged to do the daily mile. So they have a big run around their fields. But what we're trying to explain to staff is the importance of exercise and how they shouldn't shy away from encouraging the young person to participate, and that they don't need to be wrapped up in kid gloves. It's really important that if their peers are going out to play and they've got a suitable coat and suitable outdoor wear, that actually you weigh up the risk versus the benefit, and the children with CF should be going outside to play and take part in exercise just the same as their peers.
در درباره اهمیت ورزش صحبت میکنم که در بسیار از مدارس انگلستان دیلی مایل یا دویدن روزانه حتما توصیه میشه و توصیه میکنن که دیلی مایل رو حتما مد نظر قرار بدین. یک توصیه اوییدنس بیس هستش و ورزش کردن مزایایی داره که در این اسلاید ذکر کردم که باعث میشه که ترشحات دقیق‌تر بشه و کاهش پیدا بکنه، غلظتش کمتر بشه و کمک میکنه که دفع اخراج از سینه راحت‌تر انجام بشه، از عفونت‌های سینه و عفونت‌های دیگه جلوگیری میکنه، توان عضلات تنفسی رو افزایش میده، تعادل و فلکس و انعطاف پذیری رو بهبود پیدا میکنه، سلامت استخوان‌ها رو بهبود میده و باعث میشه که خلق و بهبود پیدا بکنه و مزایای روانشناختی.
Thank you. We also talk about upcoming school trips and how we want the child with cystic fibrosis to feel fully included, and all the trips should be inclusive. So we would go into school prior to any school trip and be able to provide them an example like this of daily medications if they were going on a residential for a few days, so that we can actually support school and parents to feel fully confident and competent in their child attending any school trips.
اسکول تریپ یا گردگیری گشت‌وگذارهای مدرسه هستش که اردوهای مدرسه گشت‌وگذارهای مدرسه هستش که به برنامه‌ریزی دقیق اگه صورت بگیره باعث میشه که تضمین بکنیم که موفقیت‌آمیزی هستش. درمان‌های فیزیوتراپی، درمان‌های دارویی و درمان‌های نبولایزری باید ادامه پیدا بکنه. یک پلن مکتوب باید داشته باشیم. فعالیتی که لازم اعمال بشه حتما باید مد نظر قرار بگیره. نقایص احتمالی رو باید در نظر داشته باشیم و نهایتاً اینکه مضرات رو در برابر منافع این اقدام بسنجیم.
We also highlight to school that for the majority of children, it doesn't matter if they're sitting there with a bit of mud under their nails or dirty hands after playing, but actually for a child with cystic fibrosis, it is really important that they come in, they get in the habit of washing their hands. And also at this point, we do explain to staff that children with cystic fibrosis are meant to be kept segregated from any other child or young person or a teacher who also has the same condition. And it's really important that when we meet with staff that we do explain and emphasize this point.
کثیف بودن دست‌ها برای سایر کودکان شاید موضوع خیلی مهم و نگران‌کننده نباشه، اما برای کودکان مبتلا به CF تمیز بودن دست‌ها و بهداشت دست‌ها بسیار مهم هستش، باعث میشه خطر عفونت کمتر بشه و تمام دانش آموزان مدرسه بعد از اینکه بازی میکنن وقفه‌های برای استراحت دارن یا قبل از اینکه غذا بخورن یا سایر اقداماتی که ممکنه خطرناک باشه حتما باید بهداشت و شستشوی دست داشته باشن. یعنی که بیماران مبتلا به CF نباید با بیمار CF دیگه در یک اتاق باشن و باید جدا نگه داشته بشن، به خاطر اینکه احتمال متقابل عفونت وجود داره و در این میان آموزش نقش اساسی ایفا می‌کنه.
Thank you. One of the things that we really want to highlight to the school staff is because children get taken out on school trips, because the environments in their schools can differ, we want to emphasize about thinking about Pseudomonas in particular and about avoiding stagnant water and being mindful around mud and soil. When visiting places like greenhouses and garden centres and things like that, just about that there's a lot of watering systems, there's a lot of humidity, there's a lot of water pooling. So we just say that we should avoid these. The reason that we've got the little duck on here is because quite often you get a little hole in the bottom of the duck and it fills up with water and you can't quite get rid of it and it gets quite mouldy. So you're just highlighting to staff just to check their equipment and make sure that they're clean. We also say that it's okay to have fish tanks, but they shouldn't be cleaned out in the same vicinity as a child with cystic fibrosis. And also a lot of schools are in regard to sustainability, etc., they're having compost heaps. We're just saying that the child with CF ideally wouldn't be getting involved in that aspect. And also, if they're going to visit a farm, we explain to them that when hay and straw gets damp, that it starts getting fungal spores, and if they become aerosolized, that can be problematic for a child with cystic fibrosis. So again, it's all of these environmental factors that we're just highlighting. I do actually have an infographic that I can send you and show you at the end. I can try and share that, but certainly can send that because that's really useful for us to be able to give to schools to keep.
که اشاره کردم اطلاعاتی هستش ممکن است اکتساب بشه، به خصوص نگرانی که ما در مورد کودکان CF داریم سودومونا هستش که ممکنه در گذارهای مدرسه‌ای و یا در اردوها کودکان مبتلا به CF مبتلاش بشن. محیط‌های مستعدی که این اتفاق براشون میفته گلخانه‌های گرمسیری و پرورشگاه‌های پروانه هستن یا اسباب بازی‌هایی که داخل حمام استفاده میشن و آب‌هاش هستن، آب ازشون می‌پاشه. میگه ما رو حتما باید قبل از اینکه وارد اردوهای مدرسه میشیم چک بکنیم که اشکال چیزی نداشته باشن و همیشه تمیز و بهداشتی نگهشون داریم. مسئله دیگه که هستش فیشتن که آکواریوم هستش که باعث میشه که سودومون انتقال پیدا بکنه. اشاره کردم به بهداشت و تمیزی این فیشتن ها. و مسئله دیگه هم که بود این که خیلی از مدارس و خیلی از آموزشگاه‌ها توده‌های کمپوست و کیسه‌های کوچولو دارن که این کیسه‌های کوچولو هم ممکنه باعث انتقال به آلودگی بشه و باعث انتقال عفونت به بیماران CF بشه.
So whilst the previous slide describes some things that we would definitely advise avoiding, and this is also in the Brompton guidelines at the back in the appendices, so you will be able to access this information. But things that we say to take precaution with are things like the digging in soil, the sand pits that aren't covered, and when children go pond dipping, for example, that is a classic sort of younger child school day out trip, and we just want to make staff aware that the young person should be included, but you might need to make some reasonable adjustments for that young person, because the kids find it quite funny, the children find it quite funny flicking their nets about and having a bit of a laugh, but actually the Pseudomonas that is likely to be in that pond again becomes aerosolized, and if that's inhaled can be problematic. So we're just highlighting this to remind staff that there are things that they need to be thinking about. Mud kitchens, children can use mud kitchens. Some parents prefer them to wear gloves. But good hand washing is key. And then things like the sand pits, if it hasn't got a rain cover, a really good tight rain cover on it, water is going to seep through, it will sit on the bottom of the sand pit, and again it's a potential Pseudomonas risk. So we just ask staff to be mindful and to do these checks in their playgrounds.
خصوصات اقتصادی آن محیط‌هایی که در اسلاید قبل شد محیط‌هایی بود که تقریبا ماموریت مطلق داشت برای کودکان مبتلا به CF به علت شانس ابتلا به سودومونا. این فعالیت‌هایی که در این اسلاید ذکر شده فعالیت‌هایی هستن که ماموریت مطلق ندارن و میشه با احتیاط اونا رو انجام داد، ولی حتما لازم نیست احتیاطی انجام بشه که حالا دیگینگ این سول یا خامون رستوران خودبازی خودمون شستشوی دقیق دست و صورت حتما نظامیه و باید حتما از دستکش مناسب استفاده بشه. مورد بعدی که اشاره کردم پاند دیپینگ بود یا همون یک فعالیت تفریحی هستش که در بعضی مدارس انگلستان انجام میشه و کودکان رو معمولا به تماشای آبگیرها یا تالاب‌هایی میبرن که در اونجا به کشف حروف میپردازن. برای کودکان لذت بخشه. میگه که نمیتونیم بچه‌ها رو از این فعالیت محروم کنیم، حتما باید بیماران جوان در این فعالیت انجام بشن، اما باید دقت بکنیم که تو محیط پاند یا تو محیط آبگیر ممکنه سودومونا آئروسولیزه شده باشه، در هوا منتشر شده باشه و این شانس عفونت رو در کودکان مبتلا به CF ممکنه زیادتر بکنه. پس بنابراین احتیاطات لازم باید حتما انجام بشه. مسئله بعدی این بود که حالا چیزی که اشاره کردم ماد کیچنز یا همون اصطلاح فارسیش با یک سری از وسایل آشپزخانه رو بچه‌ها می‌سازن. اینو حتما گفتن که میشه انجام داد برای بچه‌های مبتلا به CF، ولی هند واشینگ نکته اساسی و کلیدی هستش که حتما باید رعایت بشه. بازی جعبه شیمی هم موردی هستش که اشکالی نداره برای کودکان CF، فقط حتما شن باید خشک و تمیز باشه، آب نباید راکت باشه در سطحش، آب حتما باید در جریان باشه تا شن رو شستشو بده و شن باید مرتبا عوض بشه و بهتره که برای شن حتما یک درپوشی در نظر گرفته بشه تا از آلودگی بیشتر در امان بشه.
So depending on the age of the child, we also, particularly when we're thinking moving through when children pre-secondary school, so sort of from about 10 years onwards maybe, and especially during COVID, you know, children could tell us that sometimes they would get embarrassed coughing, so they would suppress their cough, and we're saying to them, don't suppress your cough, you know, but a lot of them told us that they were, because they were worried, especially during COVID, that other people would think that they had, you know, that they had the virus. So we talk about that. Some of our young people do describe having stress urinary incontinence. So we do definitely talk to them about that and how that can be supported. We know that for some children with cystic fibrosis, they can be underweight for their age. So in terms of sort of body identity, body image, and managing that alongside good mental health, we have those conversations. Jackie already spoke earlier about how some children may have delayed puberty. And some children don't like telling their friends or for people to know that they've got cystic fibrosis, and that's okay. And we have to respect that. We do encourage them to be open and to consider that it is a part of them, it's not all of them. However, some children really are adamant that they don't want to take things like their crayon in front of their peers, and so there are ways that we kind of support with that at school. A lot of children don't like having their bowels open at school. You know, we know that if a child hasn't had the right amount of crayon, their poo can be more smelly than your average poop. That sometimes there can be an orange oily film in the toilet that doesn't flush away easily, or that their stools won't flush. And we know, especially here in the UK, that the children's toilets, there's not a lot of privacy. And so we talk about getting toilet passes where children might have access to a more sort of private toilet somewhere else, just to be able to give them that bit of privacy and dignity if they need it. And then for the sort of older children, we're mindful that in secondary school, they do start talking about cystic fibrosis when they're describing genetics, and that sometimes teachers aren't fully up to date with the most up-to-date information, and they need to be mindful that there is a young person with the condition in their class that may or may not have disclosed that.
آثار روانشناختی CF رو داره بیان میکنه، میگه که پدیده‌ای که ما باهاش مواجه هستیم که گاهی اوقات سرفه باعث احساس خجالت در افراد میشه. میگن که این مسئله رو ما در پاندمی کووید هم داشتیم که بعد بیماران بیان میکنن که از سرفه کردن دچار اضطراب یا هراس میشن به خاطر اون برچسبی که قرار بهشون زده بشه که حالا برچسب کووید و برچسب CF هستش. مسئله دیگه که ممکنه باعث ساپرس سرفه باشه و می‌دونیم که خب ساپرس سرفه در CF موضوع خوشایند نیست. ما بیماران تشویق می‌کنیم به سرفه کردن. اینه که سرفه کردن ممکنه باعث ریختگی ادراری استنسی در ما بشه، یعنی باعث شدت سرفه دچار ریختگی ادراری بشن. این مسئله دیگه هستش اینه که هویت این افراد ممکنه زیر سوال بشه، زیر سوال قرار بگیره، به خاطر اینکه این افراد معمولاً جثه و قد و وزن کوچکتری از جمعیت همکلاسان خودشون دارن و ممکنه این مسئله قد و وزن کوچکتر و جثه کوچکتر باعث بشه که نقش خودشون در این کلاس نتونن بپذیرن. مسئله تأخیر بلوغ هم گاهی اوقات این کودکان رو اذیت میکنه و اینکه کودکان ممکنه اون احساس آگاهی که لازمه برای مصرف آنزیم‌ها با غذا داشته باشن نداشته باشن. بعضی اوقات مسئله که بیان کردن اینه که کودکان مبتلا به CF از بوی بدن خودشون خجالت میکشن، از بادی آدج و بوی بدن خودشون خجالت میکشن به خاطر اینکه ترشحاتشون ممکنه سیاه‌تر باشه یا بعضی اوقات ذکر میشه که مثلا دفع مواد دفعیشون رنگ خاص و بوی خاصی داره و حالا ذکر کردن که توالت‌ها در این قسمت خیلی حریم شخصی و خصوصی شاید نمیشه و اینا معمولا خجالت زده هستن از اینکه ممکنه اون بوی بدن مدفوع یا بوی بدن ترشحاتشون به مشام بقیه بچه‌ها برسه یا خیلی اوقات خیلی از این بچه‌ها مایل نیستن که به دیگران بگن که CF دارن و بیماریشون رو بیان بکنن و این هم موضوع آزاردهنده براشون هستش. و موضوعی که مطرح کردم در انتهای صحبتشون این بود که در کلاس دوم، حالا یک مقطع احتمالاً دوم دبیرستان، کلاس مثلا معادل سازی میشه کلاس هشتم، میگن که معلم‌ها شروع میکنن به تدریس راجع به CF و راجع به ژنتیک و وقتی که صحبت میکنن راجع به CF و ژنتیک چون بسیار بروز هستن و از آخرین دانش‌ها در مورد CF برخوردار هستن، معلم‌ها باید حواسشون باشه که موقعی که میخوان درس میدن ممکن هست یک نفر در کلاسشون دچار این بیماری باشه و ناخودآگاه باعث آزردگی خاطرش میشه و بهتر موقعی که میخوان صحبت بکنن حواسشون جمع باشه که در کلاس فرد مطلب CF هم وجود خواهد داشت. Yes, go.
Thank you. So in summary, we try to explain that there's no typical child with cystic fibrosis and that staff might have had another child in the school that had the same condition, but it's very individual to that person, and that some children, even siblings, can present in very different ways. So we try to emphasize that point. We also explain that the children should be and are expected to achieve their developmental milestones, and that they should be reaching their academic targets for their age. So we know that children with cystic fibrosis will be missing some school when they have to come to clinic appointments. Children don't, as often as they used to, have to come into hospital. But here at the Brompton, if they do come into hospital, they can actually receive schooling from the on-site school, which is very helpful. That we need to emphasise that these children are getting up earlier than their peers and that they do have things to worry about and they do have things on their mind in a way that perhaps their peers don't have to tolerate. And also, as I've mentioned, the exercise is something that we really do want young people with CF getting involved in, and to not, not to shy away from that either.
برای که هیچ کودک مشخصه و شناخته شده و ثابتی که با CF باشه و بتونیم اختصاصا مارک CF رو بهش بدنیم وجود نداره و CF ممکنه حتی در بین افراد خانواده و خواهر برادرهای همون فرد مبتلا هم با تظاهرات متنوعی بروز بکنه. ما انتظار تغییرات تکاملی و متأثر شدن تکامل و رشد تکامل رو در CF نداریم، بنابراین اهداف آکادمیک در دسترس هستن و متناسب با سن و اهداف تحصیلی میتونن به دست بیان. بعضی وقتا اشاره میکنن که این بچه‌ها نیازمند این هستن که قبل از حضور در مدرسه درمان رو آغاز بکنن. 1 ساعت ممکنه در مدرسه قبل از اینکه وارد مدرسه بشن 1 ساعت درمان رو براشون آغاز بکنیم و اینکه نهایتاً بر نقش ورزش دوباره تاکید کردن که یک بخش بزرگی از CF هستش که این بچه‌ها رو نباید از فعالیت ورزشی محروم کرد، اتفاقاً باید فعالیت ورزشی تشویقشون کرد و هرگز نباید اهمیت ورزش رو دست کم گرفت و مدام باید این فعالیت تشویق بشه.
We encourage school to be open with parents and to maybe have even a communication book so that if, say for instance, they forgot to give crayon at lunchtime, it happens, we're all human, but actually they could just let the parents know, and that can be really helpful for a parent that can't understand why their child's got tummy ache or needing to go to the loo when they get in from school, and any other sort of key things that they think may be important. We also want to emphasise that actually this is a young person who has cystic fibrosis but is for the most part a well child. So whilst we sort of give an overview, a general overview, we want to explain to them that the nature of the disease is that it is chronic, but actually they shouldn't become acutely unwell as a result of their CF in school. So it's really important for staff to be thinking wider and outside of the box as well. And then, yes, the other thing that I would just mention on this slide is that when children do start school, we actually provide a healthcare plan. So again, I can share that with you. If I can at the end sort of share it, I'll just show you quickly. But actually, that's a really useful document for staff to keep at school, just so that if there's a supply teacher, they've got a summary of what goes on for that child and what's important. And then we usually go into school annually at the beginning of September usually, just to give a refresher on the information that we've provided.
نگرانی‌ها رو باید تمام نگرانی‌ها رو باید با خانواده در میون بذارید به معنی اینکه هر گونه آغاز سریع الان به معنی شروع درمان هستش و درمان بلافاصله باید آغاز بشه و در این میان ارتباط موثر برقرار کردن نکته کلیدیه. به بچه‌ها باید یادآوری بکنیم که این بیماری مزمن هست، اما به این معنی نیست که اپیزودهای حاد خواهد داشت و بیماران رو تحت تاثیر قرار خواهد داد و میگه که بهترین راه برای کمک کردن به کودکان مبتلا به CF در مدرسه اینه که اونها رو به عنوان فرد درمان کنیم و به تغییراتشون حساس باشیم و اونها رو مشابه همسالانشون درمان میکنیم. در انتهای کلیدتان ذکر کردن که اول هر سپتامبر این معادل شهریور ماه تیم مراقبتی بهداشتی به مدرسه‌ها اعزام میشن معمولاً به مدرسه‌ای که کودکان مبتلا به CF دارن تا اطلاعاتی که از کودکان مبتلا به CF دست آوردن تازه بکنن و آپدیت کنن.
Thank you. I think the key message here is that, we treat children as individuals. We're sensitive to their needs and their changing needs. And that actually, for the most part, what we want is for them to come into school, leave their CF at the gate, and come into school and flourish and thrive.
Yes, continue, yes.
Yeah, shall I move on?
I'll be so thankful if you repeat your speech. I just distract for a moment.
Okay. So what I was saying there was just that what we want really is to treat these young people as individuals, to adapt to their changing needs. And for the most part, we want a child to come into school, leave their CF at the gate, and to come in and flourish and thrive.
اقدامات لازم رو براشون انجام بدیم. Yes.
Sorry, I'm not sure what happened. I'll move on to the next slide. I'll move on. So we just highlight about the timings of the CREON and the sort of 20-minute to 30-minute maximum rule, so that staff are aware of that. That on very hot days, and I know that we don't get quite so many of those here in the UK, but on very hot days, we might encourage the child to have like a sports type drink just for the electrolyte balance. That we know that children will be sort of missing certain aspects of school, and it's really important that they are given the time and the space to be able to catch up on those aspects.
موضوعی که اینجا اشاره کردن زمانبندی برای میان وعده ها هستش و غذا که یک فاصله 20 تا 30 دقیقه، قانون 20 تا 30 دقیقه بین مصرف غذا و کل اونها وجود داشته باشه. در مورد روزهای گرم صحبت کردن که گفتن در انگلستان البته به خاطر این اقلیم ابری زیاد شایع نیست، اما در روزهای گرم حتما باید مصرف مایعات و مصرف مایعات ایزوتونیک مد نظر قرار بگیره. نکته مهم دیگه هم این هست که کاهش اون احساس انزوا و متفاوت بودنی که در بچه‌های CF وجود داره رو حتما باید مد نظرمون قرار بدیم. Yes, Karen.
Okay, we're just finishing up now. These are some of the things that we would be making sure in school, that they've got their own school policy on making reasonable adjustments and managing medical conditions in school. That we actually ensure that they have a healthcare plan, that they have our details, our contact details, the CF nurse and hospital team details, so that if there's any problems at school, or if the child was to fall over and need to go to A&E, they would be able to take the supportive information about their condition with them. That when they do get older, that they can liaise with us about extra time for things like exams and having supervised breaks and possibly needing a separate room. And then also there's some resources which I'll come back to in just a minute.
قدم‌های دیگه که باید در این بیماری مد نظرمون باشه اینه که خط مشی‌های مدارس رو تعیین بکنیم برای وضعیت وقتی که بعضی بیماران در مدرسه حضور پیدا می‌کنن. یک نسخه الکترونیک، کپی الکترونیک از برنامه مراقبت بهداشتی حتما در نظر داشته باشیم و با برنامه و با مستندات مدرسه در اشتراک بذاریم. حتما جزئیات هاسپیتال RBH در مدارس رو حتما روی فایل نگه داریم. موضوعات مربوط به امتحان دادن، اوقات فراغت و وقفه‌ها و تفریح‌ها و استراحت‌های تحت نظارت رو باید مورد نظر داشته باشیم، اتاق‌های جداگانه و اینکه نهایتاً مستنداتی که بنیاد CF در اختیارمون قرار میده.
Thank you. And then this is just the final slide that just shares some nice useful links for the CF Trust. There's some videos on there. There's their new, the one in blue at the bottom is their latest animated video that is quite good for helping staff just get a better idea of you know, kind of what CF is and using that for the young people. Some young people like us to go into school and talk to their peers about the fact that they've got cystic fibrosis. They're not sure how to start those conversations, and we can help with that.
بچه‌هایی که قرار در مدرسه حاضر بشن و اطلاعات و سوالاتی که ممکنه داشته باشن بهتون راهنمایی می‌کنه که چطوری باشون ارتباط برقرار بکنید و چطوری به سوالایی که دارن پاسخ بدید. Karen, thank you. That was an amazing presentation. I really enjoyed that. And thank you for sharing your valuable time. There are a few questions. There are a few questions if you'd like me to ask. There are a few questions of audiences if you'd like me to ask.
Okay.
Yes. You mentioned in one of your slides that two patients with CF should not be next to each other. Then what should we do when they are in family and they are two siblings with patients? They are next to each other. What should we do?
Yeah, thank you. Good question. That's different. We also have families where there may be 2 or 3 siblings that have the same condition. They live together. We can't avoid that. But within a sort of hospital or a school setting, we do suggest that we make changes for that. But at home, that's fine.
خانواده‌ها معمولا ما 2 یا 3 فرزند داریم که خانواده داریم که 2 یا 3 فرزند دارن و مبتلا به CF هستن، اما در بیمارستان‌ها و در مدارس نمی‌تونیم این اجازه رو بدیم و باید حتما کودکانی که در کنار هم هستن و مبتلا به CF از همدیگه جدا بشن. Another question is that if against the psychological constant, the stress and anxiety and depression did not decrease, it increased. Are we allowed to take anti-depression drugs?
So what I heard there was that if a young person is experiencing anxiety or depression, are you asking me, can you prescribe a certain drug? I didn't.
Are we allowed to take anti-anxiety or anti-depression drugs? Are we allowed?
Yeah, I would wonder in our clinical nurse specialist role whether we actually speak to the family and consider what is going on in the wider context in the first instance before rushing to give antidepressant medication, but that would have to be a clinical decision.
بخوام داروی ضد اضطراب و ضد افسردگی تجویز بکنیم، بهتره که یک گفتگوی اساسی و مفصل با خانواده‌ها داشته باشیم قبل از اینکه بخوایم یک تصمیم عجولانه بگیریم برای تجویز داروهای ضد افسردگی. اما به هر حال تجویز داروی ضد افسردگی یک تصمیم بالینی هست و بر اساس بالین بیماری کلینیکال دیزیشن است. Another question is that in England, in UK, is there a curriculum in the books for CF?
Is there? Sorry, I couldn't.
Is there a curriculum in books, in your books for CF? Does CF teach in schools?
Oh. Yes. Yeah. So when the children get to secondary school age, when they explain to them about genetics, they often use cystic fibrosis as the example of a genetic condition. Does that answer?
کلاس دوم سکندری گرید یعنی معادل هشتم کلاس ما ژنتیک تدریس میشه در انگلستان و در اون کتاب ژنتیک CF به عنوان یکی از مثال‌های بیماری ژنتیک تدریس میشه. Another question is that using of face mask in preventing respiratory complications, is it necessary or not? Is it done in schools or not?
Yes, yeah. We don't advocate using face masks anymore at all.
از ماسک دیگه در مدارس استفاده نمی‌کنن ولی پیشی از عوارض تنفسیشون در مورد CF. And you mentioned in your slides for one of the strategies for prevention of taking for infections. You mentioned about greenhouses. Some points about greenhouses, and you told us that it is better not to take part in these activities. It is forbidden. Could you please tell them, was it due to Pseudomonas infection?
Yeah, I think where that came from is where parents were, they were contacting us and saying that their school was arranging a trip to a butterfly house or some kind of greenhouse environment. And alongside the kind of the research concerning Pseudomonas, we know that a lot of those places have misting systems. And so that means that there is the potential for sort of water to accumulate and that can become stagnant water. And so we would just say that we would try to avoid that. So it might be that during that trip, the child has to do something alternative while the kids are walking through the greenhouse, just so that they don't miss out on an experience.
موقعی که در بچه‌هایی که مبتلا به CF هستن وارد این محیط ها میشن چون اونا یک سیستم میستینگ یا مرطوب کننده دارن باعث میشه که اون آئروسول‌ها و اون ذرات در هوا شناور باقی بمونن که شانس ابتلا به عفونت رو زیاد میکنن. عفونت‌های مثل سودومونا رو بهتر فعالیت جایگزین در نظر گرفته میشه و اگر قرار در این محیط ها حضور پیدا بکنن احتیاطات لازم رو مد نظر قرار بده. And another question was about the diet. It was on one of your slides. Could you please explain your slides, which was related to your diet, because you passed it, and some of the audiences want to know about it.
So are they asking me about the smell with the toilet?
No. The diet. The diet. It was in one of your slides. You passed quickly, and some of the audiences want to know the details about the diet you mentioned in your slides.
As in the toilet pass?
Do you have access to your slides?
Yes, you can have access to the slides, definitely.
Can you show us? Can you show us the slide which was related to the diet?
Yep. Hang on a sec. Okay.
Yes, this one.
That one?
Go ahead.
Sorry, so what was your question? Because I couldn't hear you very well.
It was, they want some explanations about the diet, which you mentioned in one of your slides.
Okay, so if a child, say they have their lunch and they forget their crayon.
No, excuse me, Karen. It isn't about the crayon and the. Will you please go ahead 2 slides? 2 slides, go ahead. Yes, this one, yes. Before Portacat, yes.
This one?
Yes, this one, yes.
Okay, so this is the one. This was the example of when you have crayon, you have it with any fat-containing drink, snack, or meal. Yes. And this was the example to sort of say some of the exceptions, some where you don't have to have crayon, some of the things that you can eat where you don't have to have crayon.
این اسلاید های هست که میگه وقتی این غذاها رو مصرف میکنید، مواد غذایی رو مصرف میکنید، نیاز به مصرف کرئون ندارید. یعنی که این غذاها رو اگه مصرف بکنه فرد مبتلا به CF نیاز به مصرف کرئون نداره. چون اسلاید قبلشون داشتن راجع به غذا صحبت می‌کردن که حتما باید با کرون وقتی که مدرسه مصرف میشه کرون مصرف میشه. این استثناءاتی است که اگر غذا مصرف میشه نیازی به کرون نیست. Another question is that thank you, Karen. Another question is about keeping of pets in houses. For example, cat, dog, and birds. Is it problematic for CF patients?
Not specifically problematic. We would usually advise that people don't have birds as pets in their home, but cats and dogs are usually okay. We try to suggest that they don't let the animals sleep on their beds. Sometimes we have found with a few children with CF that they're allergic to animal fur, and that is irrespective of their CF, but it exacerbates some of the symptoms of CF. So if a child is presenting with symptoms or increased inflammatory markers, things like that, it's always worth asking if they've got pets at home.
توصیه میکنن که نگهداری پرندگان رو توصیه نمیکنن در خونه، اما نگهداری سگ و گربه رو میگن مشکلی نداره، مانعی نداره. اما اگر بچه علائمی داره که قبلا با این حیوانات تشریح می‌شده یا اگر والدین مشکلی دارن با اینکه حیوانات مثل گربه و یا بچه مشکلی داره که والدین و بچه مشکلی دارن که گربه و سگ در بسترشون و در رخت خوابشون چیزا به خواب اینا نگهداری نکنن. اما ممکنه بعضی از علائم CF و اگزاسربیت رو تشدید بکنه و باعث تشدیدهای بیماری بشه. Thank you so much, Karen, and thank you for your patience and for comprehensive presentation. It was so nice here to have you and also your colleagues. Thank you so much. Have a good time and bye.
You're very welcome. Thank you.